But I'm not working for Gilbert and David. I have a few interests of my own. And a long-standing interest is actually focusing on the motivational effects of using financial incentives to improve the performance of professionals. And this interest was really attracted me to the field is that right now in the U.S. healthcare system, we're engaged in a very large, high-stakes experiment where we're using pay-for-performance to improve the performance of healthcare professionals. And most of you, when you go to your physician, you're probably not aware of this, but chances are they're getting financial incentives to give you certain screens, tests, to try to keep you healthier, okay? And Mikhail was talking about the U.S. healthcare system and focusing on expanding health insurance, which is certainly a big part of Obamacare. But the other big part of Obamacare is actually using financial incentives, pay-for-performance, to improve the quality and the efficiency of healthcare professionals. And most of you are familiar with pay-for-performance. A financial incentive entails really three things: a financial incentive, assigned performance targets. Okay, in the healthcare context, we can be talking about for a patient with diabetes, making sure they get an annual blood sugar test, okay, so-called hemoglobin A1C test. And also the third element is that there's got to be some sort of a target recipient. It can be an individual, it can be an organization, and in principle it can be a team. That's not something yet we've done in healthcare, or there's certain discussion about that. Typically it focuses on physicians or hospitals or other types of healthcare organizations. Okay. So it really has become a centerpiece of U.S. healthcare policy. It's a really big deal. Most private health insurance plans, employer groups that cover health insurance now have pay-for-performance programs. Over half of the state Medicaid programs have pay-for-performance. And the ACA makes a huge bet, a huge investment in infrastructure around pay-for-performance. Hospitals, physicians are all now being given financial incentives to achieve certain quality targets, assigned quality targets, particularly under the Medicare program. Okay? Now, this really attracted me to think about a number of research questions, because here what we're talking about is giving incentives to professionals, okay, physicians, hospital administrators. And while there's a considerable amount of literature around pay-for-performance and its effectiveness in manufacturing settings, with professionals the idea is maybe it won't work so well, and here the literature is relatively sparse. Okay, the idea is, if you look at agency theory, goal-setting theory, the idea is, yes, if you give people financial incentives to achieve certain targets, it should motivate them to pursue those targets, and in many cases to achieve those targets. But with professionals, well, other considerations come into mind, such as the idea that, first of all, intrinsic motivation, the idea that professionals are intrinsically motivated, right? All of us are here not for salary or for pay, but because we love what we were doing and we would come here anyways, okay? Dean Courtney's rolling his eyes, but hopefully that figures into it to some degree, okay? The other thing is autonomy. We cherish our autonomy. We don't like external controls. Pay-for-performance is very much a form of external control. You're giving people financial incentives to achieve certain targets, okay? Margie's now giving us financial incentives to publish in certain journals, okay? That's a form of external control at a conceptual level. So research questions that I've been interested in is, what is the impact? What is the impact of giving professionals financial incentives to pursue assigned targets? Are there certain attitudes that may moderate that? Okay, with self-determination theory, which suggests that that if the external controls are perceived as undermining autonomy, they will not work very well. Okay, that the idea is that yes, professionals can adapt to external controls, but the external controls have to be introduced in a way that is in harmony with our desire for autonomy. Another is also, what about the sustainability incentives? You're giving people money to achieve certain targets. Does that have to go on forever? Okay, or is there some point where the incentives can be removed and we'll continue to see the desirable behaviors that we incentivize to begin with? And also, are there certain unintended consequences? So we've been running, with a lot of federal support, we've been running a variety of experiments, studies. I'll just try to highlight a couple. One was in a large network of physicians in upstate New York. They were given financial incentives to achieve several measures of quality measures for diabetes. These are tests and screens that really all patients with diabetics could have. As you can see, adherence was pretty low at the baseline. The incentives were introduced in 2002, but yet those adherence levels are actually consistent with national levels around the time around 1999. Again, there were incentives that were introduced in 2002, and if you look at the change, you might say, well, it's not bad, it's not bad, but then this kind of dampens your enthusiasm a bit, right? Because you say, well, that's just an extension of the secular trend. Those things were going up anyways, maybe with the exception of eye exam, where you do see a one-time bump up, okay? You see a change in the intercept, but then you go right back to the same trend pre-intervention. But one thing that we did here is we actually, at baseline, at the time the physicians learned about the incentives, but yet didn't know anything about their performance, we asked them about whether they saw this pay-for-performance program as potentially undermining their autonomy and what they thought about the professional goals. Okay, so this was right at baseline, in 2001, before the incentives were introduced. And here what you see is that the variation, the trends that I showed you before really mask a lot of variation, because actually you see it's really a tale of two physicians. The ones that are in the blue, those are the ones that didn't see any threat to their autonomy. They really didn't see any threat to their autonomy at all with this program. The ones in the pink did, okay? And as you can see, right at the time the program was introduced, they split off. One responds, one doesn't. You average them together, you don't see any improvement, but that again is because it really masks the variation, okay? Same thing with goal importance, whether or not they thought the quality goals were particularly important to their patients' health status. Sustainability, we've done a large experiment, large study with the Veterans Health Administration, where first incentives were introduced and then they were removed. As you can see, at the time that they were adopted, there was a considerable amount of improvement on a lot of these cardiac measures for pneumonia. Then they were removed. And when they were removed, performance stops improved. Okay? So, that raises certain concerns about how long these incentives have to be in place. And actually another study was just published that actually shows that when you remove the incentives for healthcare professionals, you actually go right back to baseline. Okay, here we didn't see that, but we saw a complete, sort of hit a wall in terms of any further improvement once the incentives were removed. Unintentional consequences, one of the studies that we've done is this was actually at Boston Medical Center. There were certain measures that were incentivized and certain measures that were not incentivized, to see if there'd be sort of a teach to the test approach to this, where they just, potentially the measures that weren't incentivized would actually go down. Didn't actually see that. You see a sort of a similar pattern, nothing really great on either side, but you don't necessarily see a decline on the non-incentivized measures. And then for future research, we're very interested in trying to understand, whether financial incentives have to sort of hit a certain tipping point before you see real changes and fundamental changes and permanent changes in the way healthcare providers provide patient care. In cooperation with Tim Hoff, we have built a relationship with a large physician network in Massachusetts, and we are planning to do a qualitative study. We're currently applying to the Robert Wood Johnson Foundation for funding, where we'll do a large qualitative study to really sort of get at some attitudes that really can't get through some of the large secondary data studies that I've done in the past. Up there.
Thank you.